More on this, let's speak now to Mary-Louise McLaws. She's a WHO advisor and she joins us now from Sydney. Mary-Louise, thanks so much for joining us here at TRT World. Now, we are about 2 weeks into the WHO coordinated solidarity trial. Already, we are seeing countries either stockpiling and banning the export of hydroxychloroquine, which is one of the compounds in the trial. Are there any early trends or results we are seeing here, and what is the earliest that we can expect some results?
The good thing about chloroquine is that we know it's safe medical supervision, so I would ask your viewers not to try to self-medicate because it can have some side effects. But it's now being trialled as a prophylaxis for healthcare workers to keep them safe and also for a treatment. The other ones are a combination of 2 HIV treatment drugs. Now, sadly, at the moment, there's only one study that's come out saying that the combined drugs don't look any more effective than what patients would routinely be offered under, the hospital ICU intensive care regime. However, these patients that have been on this combination of HIV treatment drugs have had very, very severe disease. So it may be too early to rule it out, and it may well trial better for patients that have a moderately severe, not very severe illness. They're also combining it with a multiple sclerosis drug called interferon beta, and that may help to boost the effect of the 2 HIV drugs. And then there's one that was developed for Ebola, remdesivir. It didn't appear to be very good with Ebola, but it has been trialled on non-human primates, and we're hoping that that may do better with COVID-19 than Ebola. So it's still very early days yet.
Right, and this pandemic is especially challenging for the scientific and medical community because we have encountered the virus for the very first time. So what is the latest that scientists have learned about this coronavirus?
Yes. Look, it's only been 3 months and yet scientists have learned an awful lot. And one of the things, of course, related to the Solidarity trial and memory of when we first had HIV is that sometimes when we treat patients with a new drug, we often may choose the very sick patients, and the drug may not look so promising. If we offer it to patients who are less sick, it may actually prevent them from progressing to very severe illness. So that's one thing that we are learning, and it's also a memory back from when we tried to treat HIV in the early days, where we're learning a lot about when people are most infectious, and we're also learning that for those elderly, please don't wait for a number of days before you go to your doctor for help if you're suffering from symptoms, because if they wait too long for hospitalization, say around 12 and 13, they often present with very severe disease, and it can be very difficult to treat. So please go to your doctor before a couple of weeks. If you're still having your symptoms and you're still very unwell, please go to the doctor within that week or 10 days, no longer.
Right. I hope many will listen to your advice. So go to your doctor as soon as possible. Don't wait. Now, Mary-Louise, we've been seeing a lot of new and innovative approaches to drug and vaccine discovery and development during this pandemic. Is this a global turning point for this industry?
Look, it is. And I think it's also really a wonderful coming together of more than 45 countries with 50 drug trial sites. And it's, of course, attracted over $108 million from over 500,000 individuals and organizations. So I think we are actually seeing a true solidarity across the world for this very nasty pandemic. And we may also see that this sort of behaviour continues with this solidarity of coming together with scientific knowledge and scientific exploration.
Right, okay. Mary-Louise McLaws, thanks so much for your insight for us here at TRT World. She's a WHO expert advisor.